Hi everyone, welcome back to my YouTube channel. Today we are going to talk about parietal bone. So let's start a topic with introduction. Parietal bone are a pair of large curved cranial bones that form a major portion of sides and roof of cranium. They are situated between the frontal and occipital bones and articulate with several other bones of skull through sutures. Being flat bones, their primary function is the protection of brain and in providing attachment for muscles of head. Location and structure of parietal bone. Parietal bones are located on the superior and lateral parts of skull. They are roughly quadrilateral in shape and are slightly curved to fit the rounded contour of head. The inner surface is concave and show grooves for blood vessels, while the outer surface is convex and smooth. The borders of parietal bone. Each parietal bone has four borders. First is frontal border that articulates with the frontal bone at the coronal suture. Second is occipital border that articulates with the occipital bone at the lambdoid suture. Then we have a sagittal border that articulates with the opposite parietal bone at the sagittal suture. And then we have a squamous border that articulates with the temporal and sphenoid bone at the squamosal suture. Angles of parietal bone include there are four angles, like it has a square shape or quadrilateral shape. So the first angle is frontal angle that meets the frontal bone and opposite parietal bone at the bregma. That is the point where anterior fontanelle is present in infants. Then we have its occipital angle that is where it meets with the occipital bone and opposite parietal bone at the lambda. That is the point where the posterior fontanelle is present in infants. Then we have sphenoidal angle where parietal bone meets the sphenoid and frontal bone, and mastoid angle that where parietal bone meets the temporal and occipital bone. Important features of parietal bone include parietal eminence, that is a rounded prominence near the center of external surface, often the point of maximum width of skull. Second, we have is grooves for blood vessels that are present on the inner surface, especially for the middle meningeal artery. Then we have depression for arachnoid granulations that are small pairs on inner surface where cerebrospinal fluid drains into venous sinuses. Articulation of parietal bone. Each parietal bone articulates with five bones. First is frontal bone, second is occipital bone, third is temporal bone, fourth is sphenoid bone, and fifth is opposite parietal bone. Now let's talk about functions of parietal bone. First function is protection, as it forms a hard bony covering for the brain, particularly for the parietal lobes. Second function is structural support, as it contributes to the rounded shape of skull and cranial vault. Third function is muscle attachment, as it provides attachment for scalp muscles. Fourth function is sutures landmark, as it forms key cranial sutures that are coronal suture, sagittal suture, and lambdoid suture. Conclusion of this lecture video. The parietal bones are paired cranial bones that form the roofs and sides of skull. They articulate with several other bones and play a critical role in protecting the brain, maintaining skull shape, and serving as a landmark for important sutures and fontanelles. Their strong but lightweight structure make them essential component of cranial vault. And this was all about parietal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.